Hi, my name is Dr. Jagan Mohan Reddy, orthopedic surgeon working in SLG Hospitals. I was trained in UK. I did few fellowships in sports medicine, joint reconstruction, surgeries. I'm practicing in SLG Hospitals as a joint replacement surgeon and sports surgeon. We will see a lot of shoulder problems with having a shoulder dislocations. I will give a brief talk on shoulder dislocation. What is shoulder dislocation? What are the treatment options for shoulder dislocation? So, what is shoulder dislocation or subluxation? As you all know, that shoulder is a top joint, which is one of the largest joint in the human body. This is more prone for dislocation or instability of the shoulder joint. Why? Because in the front we have weaker structures. Any injury occurs to the shoulder joint will leads to dislocation or subluxation. Shoulder instability or dislocation is one of the most disabling problem for a sports people. There are various types of shoulder dislocations like habitual dislocation, traumatic dislocation, recurrent dislocations. But I will concentrate and I will focus more on the traumatic recurrent dislocations. These are the problem dislocations. This is the problem especially for the sports individuals and especially for the active individuals. Any patient had a fall and sustained the dislocation. What is dislocation means? The joint will come out, the ball will come out from the socket. Shoulder joint is having a socket and the ball. The ball is from the humerus, that is arm bone, and the socket is at the scapula, which is at the chest, attached to the chest. So the ball comes out from the socket. So when it comes, if you have any injury like fall from a height or landed on the outstretched hand or sports or any road traffic accident, there is a risk of dislocation. So most commonly the dislocation comes from the front, that is called anterior dislocation. It may goes back, that is called posterior dislocation. We will see mainly in epilepsies, that is fits or electrical shock, we will see the posterior dislocation. But most common is anterior dislocation, means the shoulder joint comes front. So what are the clinical features of dislocation? The patient will have severe pain, not able to lift the shoulder joint and not able to move the shoulder joint. If you approach the doctor will examine carefully and he will order some investigations. Mostly we can diagnose by an X-ray. X-ray shows the socket and the ball are in disproportionate. The ball is coming out of the socket. Based on the X-rays, it may be an anterior or a posterior or inferior. That means the dislocation may come forward or backwards or downwards or upwards. The most common is the forward dislocation. Sometimes the doctor may need to arrange another investigations, extra investigations like CT scan and MRI. If it is a first dislocation, the doctor will reduce the dislocation by the sedation or with the general anesthesia. Usually we can reduce with anesthesia. Once you put back, you have to give some support for 1 to 2 weeks and simple painkillers and mobilization and rehabilitation and shoulder physio. Sometimes what will happen, it may recur it. That is called recurrent dislocations. If the dislocation is more than 3 times, it is called recurrent dislocation. If the dislocation, that means the ball is coming out frequently, then you may require a surgery. The doctor will investigate the MRI and find out what is the root cause for the dislocation. The most common cause is the Bankett's lesion. That means the tear of the labrum, tear of the cartilage from the front side of the shoulder joint, or it may be associated with bone defects called Hill-Sachs lesion. The doctor will examine and doctor will investigate and he will find out what is the cause for the frequent dislocations of the shoulder joint. Based on that, he will do the surgeries. In the past, they used to open it and do a lot of surgery that will cause unnecessary stiffness, morbidity, too much hospital stay and long prolonged rehabilitation. But now we got a keyhole surgery. The surgery duration is very less, quick rehabilitation, quick, we can do it as a day case. We can repair all inside, no cuts outside, only tiny cuts. We'll repair everything inside with the help of keyhole surgery. The advantage is quick recovery, same day discharge and predictable outcome you will have. So the shoulder instability, if you have a recurrent, that means frequent dislocations of the shoulder, consult a doctor, the doctor with an experience in treating that. The doctor will examine and order for special investigations like MRI and CT scan, and he will offer a surgery. Thank you.